name is Dr. Naran, and people ask me what made me get into this trigger point therapy. I've been a family physician since 1987 now. I qualified initially in South Africa and then came to Canada in 1991. I spent 2 years up north and as a general practitioner, and then came to North Vancouver in 1993. And I've been in family practice since 1993. In 2016, I decided just to do trigger point therapy only, and now that's all I really do is the trigger point therapy and laser acupuncture. But I've had many years of experience as a general practitioner, and I've seen many conditions. Initially in my career, I found that I was not very happy and frustrated with the way that we treated pain. We normally treated pain mainly with some medication, anti-inflammatory medications, and I would tell my patients, oh, just go to physiotherapy and expect them to get better. But I realized that that wasn't working that well. So in 1995, I got qualified in acupuncture and learned how to do that as well, and got certified in it and did acupuncture for many years, almost 17 years after that. And 12 years after that. And then I also treated pain-related conditions, and I was able to incorporate the acupuncture patients with my family practice patients as well. And I was getting good results in it. But in 2008, I bumped into the trigger point therapy. And I became certified in trigger point therapy. And trigger point therapy is not commonly known, and there's not many courses out. But it was made famous by a physician by the name of Jeanette Travell, who was in Washington, D.C., and she was the personal physician for John F. Kennedy. And there were some practitioners that learned from her, and they're still teaching this course out in Washington, D.C. So I went over there in Washington, D.C., learned these courses, and in 2008 became certified as a trigger point therapist. And ever since then, I've been doing this trigger point therapy and have never really looked back. I'm happy doing it because the patients get better and patients are happy as well. And I've also do something called laser acupuncture as well, which is also a modality which I find that in conjunction with trigger point therapy, it seems to work well as well. So with trigger point therapy, it works towards deactivating the muscles that make up the joint, while the laser acupuncture works on the ligaments that keeps the joint together. And most pain conditions are either muscles or ligaments in my experience. And so far in the last 10 years, that has held up for me. From my experience, rest is one of the most important things that you could do. And it's also very important that you don't aggravate it, because what we're doing is we're treating muscles. Now what happens is that if you exercise too much, then these muscles get re-injured again, and when they get re-injured again, the pain problem starts all over again. So that's one of the most important factors. So don't re-aggravate it, and watch the amount of activity as well. Also with activity, some people tend to exercise too much as well, because what happens when the muscles get fatigued, when you do too much with it, then it breaks as well. So some people can tolerate maybe 10 minutes of activity, but they do 15 minutes, then it's too much for their body. So you have to be careful and find the right balance as well. In terms of other modalities of treatment that you can try while you're doing trigger point therapy, I find chiropractic very helpful as well. And if you are going to a chiropractor, yes, please continue as well. Otherwise, the laser acupuncture that I've been doing for a while is also very useful as well. And the laser acupuncture works towards releasing the scar tissue in the ligaments of the joint, while the trigger point therapy is deactivating the muscles. Now, my problem with that is that most problems in my experience are actually muscle related, and the muscles have become injured due to some force or strain that has taken place. You've either done too much activity or done it too hard and too fast, and that's where you got the muscle injury. So I don't think that by strengthening the muscles you're going to get better, but it really depends on your pre-fitness level as well. If you're a professional athlete, then you seem to get away with it, but for most people, these muscles tend to break because of this increased strain. So the first thing that needs to be done is a method to decrease the muscle sensitivity, and that's where the trigger point comes in. By decreasing the muscle sensitivity and calming it down, then you can start some rehabilitation program slowly. My general principle with trigger point therapy is that you should be at least 60% better, and then when you're 60% better, you can start a rehabilitation program. But it should be supervised, and you should do it slowly, because you don't want to re-injure those same muscles again. So sometimes when you get the treatment as well, but the pain doesn't seem to be going away or not completely away, and what are those factors that may be perpetuating it? The most common one is that the muscles are under continuous strain, and those muscles have not been allowed to relax. So what does that mean? So say if you've got neck and upper back pain and you sit at the desk all the time, and you're looking down at the computer screen or something like that, so those muscles remain under strain all the time. So they don't really get a chance to relax or release, and that's why that problem continues. So you have to break that cycle. What you have to do is every 1 to 2 hours, get up from the desk, move around, get things moving as well. Very important that you watch your posture as well. Where is the monitor? Is the monitor in front? Is your neck twisted? Are you feeling it there? Is it too low? Are you slouched over? Is your seat too soft? And you have to watch all those factors because that definitely affects it. Also, it can be affected if you're doing too much exercise as well, because those muscles never get a chance to recover as well. The other medical things that can perpetuate the pain are things like a low iron. So if you have any history of any low iron, make sure you check that. A low thyroid or hypothyroid can cause that as well. A low vitamin B12 and a low vitamin D. Those are the 4 most common factors that may perpetuate pain that has been going for a long time again. So either ask me or ask your family doctor, but the 4 factors again that may do it is iron, thyroid, vitamin B12 and vitamin D. So yes, stress makes muscles worse. But stress did not cause those muscles to get injured and cause your pain in the first place. Most of the time, the pain has been caused first by an injury or a strain, and then stress made those muscles worse. So what happens is that if your pain area is this much normally when you injure it, when you stress, then the area becomes amplified and becomes much, much bigger. And then it takes longer to get away as well. So yes, the less stress you have, the less anxiety you have, the more you can relax, all the better. So find some mindfulness exercises, some relaxation exercises to do as well while you're doing this therapy as well. Very helpful is to find some visualization exercises, put some headphones on and learn how to relax the muscles as well. Generally, the answer is very, very unlikely. But if you do have chronic pain been going on for many, many years, and the trigger point hasn't worked, the laser has, just works somewhat, then I definitely want you to consider food sensitivity. And that you can only find out by trial and error. Really, there's no blood test that is around, or nobody can really find the exact correlation between food and pain. But really, this is just for patients that have had pain for a long time and nothing seems to help. What are the common food sensitivities that can occur? I think the 2 main groups are gluten sensitivities and milk sensitivities. So if you really do want to try something, then what you could do is stop gluten at least for about a month and see what happens to your pain, or stop milk and milk products completely and see what happens to your pain as well. But this is mainly by trial and error. That's the only way you're going to know. But really, this is not written in the books, but from experience, definitely food is important, nutrition is important. There's many patients that have told me anecdotally, yes, I've stopped this group of foods and then I feel better as well. And I always think, where did this come from? But yes, it can happen. So if you are one of those, definitely try getting off certain foods and seeing what happens. But for most patients, it doesn't really play a major role. So the 2 main supplements that seems to help chronic pain is vitamin D and magnesium. There is a whole lot of other things, anti-inflammatories out there as well. I don't have much experience in them and I'm not strongly recommending them. But vitamin D and magnesium are probably the base. Magnesium seems to play a role in almost everything in conditions. It plays a role in anxiety, depression, insomnia. It's good for diabetes, good for high blood pressure, obviously good for muscles as well, good for muscle cramps as well. So for patients that have chronic pain, definitely take magnesium. What dosage of magnesium to take? About 200 to 400 milligrams of elemental magnesium. Now it's important that it's elemental magnesium because that's the actual amount of magnesium that's in a tablet. So sometimes you may get a tablet that says magnesium oxalate, and it's written 600 milligrams. And then when you look carefully, you'll find that the actual milligrams of the magnesium is only about 50 milligrams of magnesium, while the rest of it is something else. So on the whole, you want to take at least about 200 to 400 milligrams of elemental magnesium. If you are interested, please let me know more. There are some magnesiums that are better than others as well. In terms of vitamin D, my general recommendation is to take at least 2,000 international units daily. This is a general recommendation, but also a good recommendation for anybody in pain. Other than that, when there is sun, make sure that you expose your skin to the sun especially out in this northern hemisphere. We don't get much sun, but use the sun whenever you can and expose your skin to the sun. In terms of the other supplements, I don't really have too much to say on to it. Yes, there could be some, but in my experience, I feel these two are the most important for now.